Good morning. It's nice to start the day. I'd be covering on angiography, how to get started in practice.
I have another session is also.
I have no financial interest in any of the equipment. Fundus photography, fluorescent angiography and ICG angiography have enabled us to evaluate the anatomy of the pathophysiology of various retinal and choroidal diseases and is an essential diagnostic tool. So how do you get started? You need to look into three things, that is the place, the personnel and the equipment. The place would include the space required and other considerations. Personnel would be the nursing attendant, the technician or a doctor to perform the angiography, equipment in the form of fundus camera, drugs and other equipment. The place needs to be adequate. You need to move around the fundus camera. You need to have a space around it. Windows to be darkened. You need to be a bit dark adapted to be able to see inside when you're taking the angiography images, because sometimes you feel that you keep clicking but then you don't get an image. It's air conditioning. Air conditioning is generally good because it reduces dust. So you need to keep the dust as low as possible because this tends to collect on the lenses and destroy the quality of the image. A good lighting is necessary so that you could cannulate the vein, and you should have a couch or a bed in case of emergency. Patients do have problems when you are undergoing fluorescent angiography, so you should be able to make them lie down somewhere if there is a problem. A nursing attendant is good because they would assist the procedure, help you in the time when there are complications. They would be able to take the informed consent. This is an interventional test, so you need an informed consent. They would also enable them to inquire about the history of allergies in the patient and maintain an emergency tray. So these would be the functions that a nursing attendant would have. Taking the photography, a technician does the photography in a lot of places. They are very good in taking the photographs. The doctor is good in one way because he knows the pathology, so he knows what to concentrate on and where to take the angiogram. There are basically two types of fundus cameras. One is the laser based, which has the HRA or spectralis. This has a low light exposure, continuous imaging. It uses laser light to scan the fundus and take the images. It also enables you to have simultaneous FA-ICG images. Also has confocal optical system, so it gives you a very high image contrast and enables you to do autofluorescence. The images of this is excellent. The drawback is there is no color fundus imaging facility available. Coming to the flash camera, there are various manufacturers like Topcon, Kowa, Zeiss. It enables you to do fundus photography, which forms an essential part of any presentation. It has an autofocus facility now with alignment dots, enables you to take photography without a problem, not much of evaluation needed when you take a photograph, enables you to do in small pupil mode. So these are the newer technology that has come in for all these cameras and enables you to take pretty good images, and they are fairly economical. This is the Topcon fundus camera, which is extremely popular. This is one fundus camera that we have of Topcon, but basically we use it for our diabetic screening program. The fundus images are pretty good. This is a Kowa camera which we have in another place. The fluorescent images are good, very adequate and satisfactory for you to do any evaluation. The Zeiss camera is good in providing you very good photography. However, you should be careful that the original camera back is excellent. However, if you want to lower the cost and you buy the alternate camera back, then the images are not so good. This is something that you have to be aware of. If you want good images, you have to go for the original equipment. However, Zeiss has now come out with a newer model which enables you to get good images and it's economical. These are the images of the HRA. You can see the clarity, you can make out all the structures, You can see the FAZ, you can find out all the retinal vascular abnormalities, you can see CNP areas. It's got an excellent image. However, it's the most expensive. This is the simultaneous FA-ICG images that you could get with the HRA. The Spectralis has an additional advantage. It gives you OCT along with the fluorescein angiography. So it enables you to do complete evaluation of the retina. There are some new instruments in the form of Navilas which enables you to do laser along with the fluorescein angiography. So before you conclude your discussion, you should look at image resolution, whether there is color fundus photography, ICG imaging, whether it is good. Look at the imaging software and the ability to manipulate. Look at the viewer's license. All the companies look for viewer's license because each station that you need to view, they'll charge you for it. Find out whether it is DICOM compatible to store the images and transfer the images, archiving mode and storage, and the cost ultimately. You should remember that fluorescein angiography is an invasive test, so prepare for emergency in the form of airway, emergency oxygen, drugs, scalp veins, syringes, and cannula. What are the problems? Problems are getting good pictures, interpret the pictures, and the photographic methods or digital methods, which will be discussed subsequently. I will just concentrate on a few systemic common problems that you can encounter. On the injection site, you might have extravasation. If there is extravasation, stop injection, apply a coat pack, or inject local anesthetic via another syringe. This will reduce the pain. Otherwise, it's a very painful situation. If you use a scalp vein, just allow the blood to rise to the hub and then inject. So the initial injection will be the blood of the patient. So generally, extravasation, if it happens, does not produce too much of pain. Some cases you might observe no dye. Just because you have flexed the hand, sometimes you won't get any dye, so you just need to raise the hand. The other common problem in nausea and vomiting. Nausea is the most frequent, and usually when you inject fluorescein rapidly. But to get good images, you need to inject fluorescein rapidly. So this is a part of the problem itself, that you need to inject rapidly to get a good image, but then nausea is a common problem. Vomiting occurs about 40 to 50 seconds after injection. So initially take the pictures, then you look forward to this problem occurring, so you do have time. So the initial phase is not lost. Don't lose the initial 30-40 seconds to take the initial pictures. Keep a receptacle ready. You could avoid this by keeping the patient fasting for about 3 to 4 hours. Hyperventilation reduces nausea and vomiting. So ask the patient to hyperventilate in this situation. When they start feeling nausea, it generally subsides. You could give some Phenergan if they have a previous history of vomiting. So generally once we have a patient who has this, we just make a note that they have this, so that we could always give this subsequently if they need a fluorescein angiogram. The other problem is vasovagal attacks. You should remember that these patients would be undergoing an interventional test, so they have the fear of the test. Vasovagal attacks are common. It's not because of the dye. The vasovagal attacks are the more problematic situation. So you keep a couch, they generally recover. Rashes are also seen quite frequently. You could give antihistaminics and this generally subsides. If more severe allergies are generally rare, so like in the form of bronchospasm and anaphylaxis. So you should be very careful, watch out for this, keep the emergency tray ready at all times. Before doing any test, please ask for allergies, because if they have a tendency for or drug allergies, then they have a tendency for some of these problems. And tell the patient that after going home to watch out for symptoms and report to you if they do have. Sometimes you might find that there are some rashes become very severe and you need to give either a steroid or anything. Don't see if you can avoid giving it in the same cannula, because now there is fluorescein dye in the scalp vein. So you inject it, you are again injecting fluorescein dye. At that situation, when it is mild, generally the patient is not collapsed, you can always give it in the other vein. This scalp vein is kept so that when the patient has a severe reaction, you will be able to start an IV line and start the other drugs. So in conclusion, it's an essential diagnostic test. It's an interventional investigation. You should remember that. So an informed consent is essential in this. The fundus cameras can be grouped into economical category and those which are expensive, but they give you excellent pictures. The choice of this would depend on your practice and the costing. So if your practice is large, then you could always go in for any camera that you'd look for. Systemic side effects must be kept in mind, and you should be ready with an emergency tray. Thank you.